Good morning, everybody. One of our regularly scheduled updates on COVID and where we are in Colorado. Yesterday, 1,668 new positive cases. Colorado is really seeing the same trend that is occurring across the nation with increases in cases, particularly among the unvaccinated. We remain one of the lower states with regard to overall incidence. However, we are seeing the same types of increases that they are seeing in other states. We currently have 501 Coloradans that are in the hospital for COVID. There's been a lot of interest lately about the cases in younger folks, so I'm going to start reporting on a little bit more about the age demographics of those hospitalized. There are 7 kids 10 and under among the 501 hospitalizations. This most recent data we have. There's a few day lag on that. And there are 10 kids that are 11 and 19, so that would include some folks that might not be kids, 18, 19. But we're going to work on parsing that down and try to report on the 12 to 17s because they're eligible for vaccines, and then 11 and under. But right now, that is just a small part of the hospitalization. As you know, this virus is much more severe for older people. And there's also a correlation with different pre-existing conditions. But the highest hospitalization rate and fatality rate are folks in their 70s, 80s. But it really, every decade, the risks are higher. The risk is higher for somebody who's 62, then 52, then 42, then 32, and so on down. We are not currently in jeopardy of overwhelming our hospital capacity. And everybody who experiences any illness in Colorado will get the very best care that we can provide through our hospitals. With the rise of the Delta variant, and many schools have returned, are returning. Many parents and families are excited about the return to in-person learning. And they're also anxious, and particularly for young kids who can get access to the vaccine. Of course, for parents of kids that are in the 12 to 17-year-old age group, I strongly encourage you to have your child vaccinated. That's the most effective protection by far. We also know that school districts have implemented a number of layered protections in conjunction with their county health department. And those look a little different in different places, but they include things like testing, symptom screening, staying home when sick, ventilation upgrades, mask wearing, social distancing. We want to make sure that schools are one of the safest environments for students, and that's why we were largely successful last year to get Colorado students back in school, which we're very excited about. And this July, based on updated CDC guidance, we updated our guidance for schools on how best to ensure safety in the classroom. One of those recommendations is regular testing as a key component for limiting the spread of the virus, given the higher percentage of asymptomatic cases for younger people. A larger number of 7-year-olds, 12-year-olds don't exhibit any symptoms compared to 50-year-olds, 60-year-olds, 70-year-olds. Although, again, one of the nefarious things about this virus is there are even people in their 50s and 60s that are contagious but don't experience symptoms or extremely mild symptoms that they miss. So that's one of the reasons this virus spreads so effectively and efficiently is some people who have it simply don't know they have it and unwittingly spread it. I'm also proud to announce that Colorado is providing free voluntary rapid testing to schools on a weekly basis to all kids who want it for participating districts. That's all Colorado schools for the 21-22 school year. This new program starts in early September. It's already available to districts. If districts would like to request testing, we have that. We think that one of those layered protections can be regular surveillance testing of part of your student body or even your entire student body. And remember, none of these is a silver bullet for stopping COVID, right? So it's some combination of, for the safest possible school environment, it means mask wearing, social distancing, cohorting, ventilation, surveillance testing. I don't think you'll find too many schools that are doing all of those things. What you will find is schools are figuring out what package works best for their community to keep schools safe and keep schools open. Testing is a very compelling one for screening. That's the way that last year, when there was a lot less testing than this year, that's the way like the Broncos organization in their bubble were able to operate in the football season by doing testing of everybody who went in. we now have that level of testing for schools. It's really wonderful. Every school child in Colorado can have the same level of protection as a Denver Bronco. And it simply takes buy-in from the school districts and families to do that. This program is completely optional, of course, for districts and schools and parents. Nobody has to be tested. But the safety of our children is an easy choice to make. And I want to differentiate here. Everybody who has any symptom, of course, should be tested. What we're talking about here is testing of healthy people so that if they are, at that point, contagious, they would stay home from school. So it's regular surveillance testing. It's like what the Broncos did. We now have it available starting in early September for every kid in Colorado. And for districts that want to start earlier than early September, we have some of that testing available and can furnish it already. The contractor might change that first week in September. To increase participation, we really want to meet school districts where they are. Schools will be able to select a full service option. That means the state contractor can provide all services to provide the rapid testing, staffing. They can also choose direct shipping option, where they get the testing supplies and they do the rest. And we are working very hard on giving an extra incentive for that, both an incentive to school districts, and we're exploring with the federal government, because this is all federally funded, what that individual incentive for participating students and families might look like. We hope it's somewhere in the $5 to $25 range to participate in this program. Just an acknowledgement of the fact that, yes, it does take a little time, and maybe it means your kid has to get to school 20 minutes early. And we want to make sure that in addition to the epidemiological benefit, that there can be some kind of incentive around that. Those details will be rolled out later, but there will also be financial support to school districts that opt into the program in acknowledgement of their work. So we are now making sure that districts all know this is available. Enrollment is open. You can go to covid19.colorado.gov/free-testing-schools. That's the URL there. And again, there is no silver bullet, but surveillance testing has been proven to be one of those techniques. Again, along with wearing masks indoors, ventilation, cohorting, 3-foot distancing where possible, 6-foot distancing where possible, vaccination of teachers and eligible 12 to 17-year-olds. All of these things can be layered on top of one another to provide the safest possible school environment and to make sure that our schools are able to remain for in-person education. In addition to the regular testing for schools, our guidance, as you know, which is the CDC guidance, is universal mask wearing. And we're also proud that we will continue our mask delivery program for schools across the state. Now, what does this mean? When schools say mask wearing, they usually mean that students wear a mask like this, or perhaps one of the disposable varieties. But we all know that the KN95, the medical grade masks, are even more effective than this type of mask. This type of mask has been estimated about a 50% efficacy in reducing the spread of the virus. The medical masks are much higher. Nurses and doctors wear them on COVID wards and rarely contract COVID. We launched that in 2021, and we delivered 8 million masks to 412 schools, public, private, charter schools, 4 million surgical masks, 3.8 million KN95 masks. We will continue to provide those masks and make that available to those who want it. And that includes both vaccinated and unvaccinated teachers, school personnel, and we are exploring how we can provide more of those. As you know, CDPHE released its guidance on how to ensure safe, uninterrupted in-person learning in mid-July, which was largely based on the CDC recommendations. Colorado prioritized educators for vaccine distribution early on to help get schools back. I got to join many of our school-based vaccine clinics. We know that vaccines, masking, testing, symptom screening, all of these layered protections are very, very important. We at the state are providing science-based guidance, vaccine clinics, testing, which we talked about today, free medical grade masks, and testing options. And we look forward to working with county health departments and schools to implement those across the state. And many of our young students, especially those 11 and under, are not yet eligible for vaccination. We hope that comes quickly. But in the meantime, we see a lot of districts really stepping up to take additional levels of protection especially for those who are not yet vaccinated. And I applaud the many school districts that are working on making sure that through layered protection, including mask wearing, surveillance testing, ventilation, schools will remain in person throughout this year. We really all have to do our part, and the science shows us that failure to implement these policies could result in more Colorado children needlessly getting sick. It is our top priority to keep in-person education and for kids to be safe. As you know, the State Board of Education, our superintendents have asked for authority to tailor these local health policies for their schools. We agree with that. We're honoring the tradition of local control in these decisions. When we reached 70% of adults vaccinated in the state, we ended the health disaster emergency that had been in place for a year, returning the normal order to decision making in our state. That doesn't mean no health orders all the time everywhere, because we know that county health departments have the authority to do orders. School districts have the authority to implement their own policies, regardless of what their county health departments have required. So in some cases, it might be a county health department requiring a certain mitigation step. In other cases, it can be private businesses, private schools, charter schools, public school districts taking the additional steps necessary to keep kids safe. Our bottom line, of course, is that we want in-person education to be in place this year. And so districts have the flexibility to make it safe, but they have to maintain that in-person education. And of course, we will always, as our North Star, look to hospital capacity. And our current hospital capacity is not a risk for people of any age. There's about 7 people, 11 and under in the hospitals, about 500 adults. Not pleasant numbers to think about, because each one of those is somebody's brother, mother, sister, father, uncle, aunt, but not in jeopardy of overwhelming our system, and we retain the very best quality of care for anybody who contracts any illness here in Colorado. My own kids are excited to get back to school in a couple weeks, or only a week and a half. I know many students have missed their friends and teachers. Districts are also taking steps to increase the vaccination rate among their teachers, encourage mask wearing of teachers. But I think the important takeaway that people should know is that there is no one silver bullet. And sometimes people focus on just masks or just vaccinations or just ventilation. There's no question vaccination is the most effective, right? So for 12 to 17-year-olds, for teachers, it's number 1, 2, and 3 are vaccination. But then quickly you get into a lot of other measures that can help. And that's really the thoughtful work that county health departments are doing with school districts to find out what can work to make sure that schools are a safe environment. Given the vaccinations are the most important, the most effective, and if you look at the states with the highest COVID rates, it's the states with the lowest vaccination rates, and vice versa, the states with the lowest COVID rates are the states with the highest vaccination. We're continuing to do everything in our power to increase Colorado's already strong vaccination rate to make it even better. I am personally thrilled to finally hear that the FDA will be approving booster doses for those who are immunocompromised. We want the maximum flexibility out of that. We have plenty of doses in our state, ample evidence to show that there is a waning immune response for those who are immunocompromised and the elderly, and that a third dose can in fact remedy that for those who want it. So given, again, the much more dire consequences of this virus for people in their 70s and 80s and those that are immunocompromised, any action from the FDA is extremely welcomed in this regard. I also reiterate our call for final approval of the vaccines, as well as we hope that they expedite their work to approve vaccines for 6 to 11-year-olds. Currently, 73.14% of our adults are immunized with at least 1 dose of the vaccine. That's 65.4% are fully vaccinated. The numbers are good, but unfortunately not sufficient to control the virus. Everybody who is vaccinated can have greater confidence that they're less likely to contract the virus, and that if they do contract it, they'll be far less likely to be hospitalized. But we have not yet reached the level to contain the population level spread of the virus, with 65% of eligible Coloradans vaccinated. And I know some Coloradans have taken a wait-and-see approach, or they just haven't gotten around to getting their vaccine and they need that extra nudge. That's where our Colorado Comeback gift card giveaway comes into play. It's been very effective using Walmart gift certificates and other incentives to be able to nudge people over to get them vaccinated. We've really been blown away by the response of the program. at the sites where it's been administered, they've seen a 71% increase. Overall, I should point out, we have seen an increase across the board in vaccinations, more in the 20 to 30% range, but in part because of the response of folks to the Delta variant and what's happening here and in other states. But it's been a higher increase where the gift cards are available. We are going to continue that program with an additional 15,000 gift certificates to get even more Coloradans to make the right choice to get the life-saving vaccine. You can find out information at cocomebackcash.com. Finally, if you wonder where to get vaccinated, it is super easy, but maybe you just haven't been focused on it and want to know, go to cocovidvaccine.org. Hundreds of sites across the state, whatever you like. It could be at your grocery store while you pick up your groceries. If they have a pharmacy, it can be at your doctor's office. It can be community health clinic, hospital, stand-up clinics across the state. It's very easy to do. Make that choice today. 1-877-CO-VAX-CO, the most effective and powerful tool we have to contain the spread of the virus. Before today, I just want to also remind everybody how important testing is to defeating the virus. And we've had terrible air quality because of the California fires, particularly the Dixie Fire, over 400,000 acres. And as a result, many Coloradans are experiencing symptoms of the bad air, and unfortunately those align with COVID symptoms. It might be a sore throat, a runny nose, a cough, and they might be due to air quality, or they might be due to COVID. And you shouldn't just rest on the assumption that, oh, it's the air quality. Ignoring symptoms means putting yourself and others at risk of severe COVID-19. So please, if you are experiencing symptoms, especially with the Delta variant prevalent, get tested. It's free, it's quick, it's private, it's easy. You can find hundreds of testing locations at covid19.colorado.gov/testing. We are in this together. And I am proud, Colorado, of how far we've come since those early days. I'm proud that we have one of the lower incidences in the 50 states. I'm proud that we have in the top tier of vaccination rates, not the top, we have room to improve, but we're in the top quarter of states, half to quarter of states. And while vaccinated individuals are, of course, generally enjoying their lives without great daily fear of severe disease, our unvaccinated population is still at great risk of severe consequences from the virus. And of course, many of those who are vaccinated, if they're in a high-risk group, are also taking additional precautions like mask wearing and avoiding indoor social gatherings. You know, some of the unvaccinated people that I've heard from say things like, I'm choosing to wait, or I've weighed the risk of getting COVID against the risk of getting the shot. And I just want to point out that if you do that in an analytical way, the answer is clear, unambiguous, overwhelming, that the risks of COVID are far greater than any perceived risk of the vaccine. Not even in the same ballpark, not even a close call. The effects of long COVID on the 5 to 10% of COVID survivors who have symptoms months, perhaps even a year later, the death rate. It is a clear, simple calculation. I really encourage those who are in that camp to do the research. Look at legitimate sources of information, CDC, international health agencies. Look at the data on the ground. You can see the areas with high vaccination rates with low COVID, and the areas that have low vaccination rates and high rates of COVID. It's very clear. It's also about more than individual choice. It's about our responsibility to one another, because, you know, if you're unvaccinated, you may think you'll get light symptoms. And by the way, it doesn't discriminate. You could be a perfectly healthy 34-year-old who runs every day and still get severe symptoms, or you may get light symptoms. It's really a mystery. But it's also about those that you could potentially infect. Your aunts, your uncles, your parents, your elderly neighbors. The Gospel of Matthew states, "Thou shalt love thy neighbor as thyself." And getting vaccinated to protect yourself, first and foremost, protects you, but it's also an act of love to protect your neighbor and protect those that you're around by reducing their risk of contracting the deadly virus that right now today has 504 people in the hospital in Colorado. Many of them will recover, some of them won't. So let's care for our neighbors. With every shot in our arm, we're demonstrating love for our neighbors, love for our children. We're taking a step towards a safer, in-person learning experience for kids, and a step to avoid overwhelming our hospital capacity. Thank you all, Colorado. Stay safe, Colorado. and happy to open this for questions.
Are you seeing evidence that the Delta variant is driving transmission in that younger age group up to 11?
The data shows that the Delta variant is more transmissive across all age groups. And in fact, the single biggest factor in reaching that conclusion with a high level of confidence is that it has essentially crowded out all other variants in our state. We're now at 97, 98% Delta variant. And yes, it is more contagious in all age cohorts, whether you're 4 or whether you're 44 or whether you're 94.
Can you talk about how important it is not to get back to the numbers that we saw last year and emphasizing the testing in schools, right? Because if we don't do this and we see these numbers spike, then what happens essentially?
Yeah, so the concept of having a layered protection in the school environment is very important, and that means you can't just do one thing and throw everything else to the wind. So if a school district says everybody's wearing a mask, but there's nothing else we're doing, that does not work. Masks reduce transmission by about 50%. That is not enough if you don't also have some kind of thoughtful approach to screening symptoms, to making sure that sick kids stay home, hopefully some kind of testing regime, maybe some kind of quarantine regime, ventilation. Figuring these things out in a way that works is a key part of making our schools safe. And absolutely one of the it's not new, but one of the amplified weapons in that arsenal now is testing. It was available before, and we did it largely on a surge basis. So there were schools that had outbreaks and they wanted to get back, and we said, yes, why don't you screen your kids, and then they don't have it, they can come back, and effectively the outbreak's over. But now, what is available is more widespread surveillance testing. Now, again, it's up to not just school districts, it's up to individual parents to take advantage of that, because it doesn't do any good if 1% it doesn't do any good, it does very limited amount of good if 1 or 2% of people participate in that. That's one of the reasons we are trying to align an incentive piece around that to get the level of coverage where there's a additive health benefit to the screening process and the testing process on top of the other protections the schools are doing.
It's rapid.
It's rapid, yes, it's rapid. Minutes, 10, 15 minutes, yeah.
Governor Polis, Sarah Flower with KSUT Four Corners Public Radio. I'm hearing a lot of recommendations and requests in terms of testing and masking. What is it going to take for you and your department to put a mandate in place?
Well, we have echoed the CDC guidance, and currently there is a lot of letters and influence coming from medical professionals to school districts saying we recommend this set of policies or that set of policies. Some of that seems to be focused around masking. We certainly welcome kids being masked inside to be protected, but to be clear, that is not sufficient as a protection. You can't just throw everything out the window and say they're wearing masks. You need a more thoughtful, integrative approach that needs to be operationalized at the school district level. Across our state, school districts are working with their county health departments to find the best set of policies that work in their area. The state is supporting those, meaning, of course, we support mask wearing, that's in our guidelines, but we financially support things like mask wearing with quality medical grade masks for teachers. We support testing, putting our money where our mouth is. Well, frankly, it's the federal government's money where our mouth is. That's available. Anything else that schools need to retain safe in-person learning, we are happy to help provide that.
Governor Chris Vanderveen with 9 News. I want to add an offshoot to what you just answered there, but I want to ask it. I want to see your thoughts on this. We're clearly getting lots of thoughts and opinions from parents that want to see you and hear you implement a mask mandate. Clearly, you're not going to do that, but I'm curious what your message is in terms of the metric that you're looking at. Are you simply telling Colorado that until that hospital capacity and that metric is reached and potentially breached, you're simply not going to implement a statewide mask mandate or any other lockdown measures? In other words, are you simply making that the metric, hospitalizations, as the singular metric that you're going to use moving forward to possibly implement any sort of statewide measures?
No, there's one other metric with regard to schools. Certainly hospitalizations is the metric across the board. We will not overwhelm our hospitals. We will take the steps necessary to avoid doing that. We have, we are, and we will. The other metric for schools is in-person education. If we see that districts are failing to be able to stay in person simply because kids aren't wearing masks, we will absolutely look at taking action. It is more important that schools are in person and the kids are able to benefit from that learning environment in a safe way than that people are, and again, you're focused on masks with your question, but I want to also indicate it's broader than masks. We talked about layered protections. Masks are one of those. It's also things like symptom screening, surveillance testing, ventilation, cohorting. There's a number of these. It is possible if a district is failing to implement these, they may fail to stay in person, and we may have to find a way to go to them with a package of things saying, you know what, it's not a good excuse just to say you're all virtual for the semester. You need to implement these safety measures. And maybe if you really don't like in your community mask wearing, maybe that means you do universal surveillance testing and you do ventilation and cohorting. I mean, I personally think that mask wearing is a simple, easy one that combines with others. Many districts are implementing it. It helps. But you can't just say you're doing mask wearing and nothing else either. So there are two bottom lines for us. There are only 7 kids 11 and under in the hospital with our most recent information. We are not at capacity. There are 500 adults. We watch that. We don't wait till we're overwhelming our hospitals. We watch the trend, and we act before we overwhelm our hospitals. And then the second one is in-person education. We will not allow hang-ups around particular prevention protocols to prevent kids from being in person in school, which is the best environment to learn. They've already lost half a year, 3/4 of a year, depending on where you are in our state of in person. We can't afford to lose more of that.
Hi, Governor. Excuse me, Seth from the Gazette. Piggybacking on the school questions. One, so you've talked about the state's success in having people in person, having students in person in the spring. Wasn't a reason for that because there was a standardized mitigation approach across the state. And two, you've kind of talked about masks not being the be-all, end-all, and that's maybe a reason the state doesn't want to apply it because there needs to be layered. But I mean, the state requiring masks doesn't preclude districts from adopting more. Right? The state can say we're requiring masks for students and also you should be doing these other things. Thanks.
Yeah. So some states, as you know, are banning mask use in schools. Colorado is not only not in that camp, we are officially recommending mask use in schools. So we are taking a very different tack than states where they are trying to prevent or do away with mask use in schools. We believe that they are part of a layered protection system that can keep schools safe. Not to the exclusion of other methods, but they are an important part of providing a safe learning environment. I would also indicate that in districts where, in every district in our state, whether it is required or not, your kid can wear a mask. And I absolutely would encourage parents to make that choice for their kid if it works for their kid to help provide that extra level of safety for their kid, particularly if there are unvaccinated adults at home, or particularly if that kid has a pre-existing health condition. That would provide an even greater reason to make sure that your kid is masked.
Hi, this is Johan Castellanos from Telemundo. 2 quick questions in Spanish. ¿Cuál es su opinión acerca de las nuevas dosis o boosting shots, como lo llaman? Y si está de acuerdo, ¿no será mejor enfocarse en los hispanos no vacunados? Porque hay muchas personas que no se han vacunado todavía.
Sí, estoy de acuerdo, ya que hay muchas personas que lo quieren y ellos deben recibirlo, especialmente las personas de tercera edad. Algunos pueden recibir el tercer vacunado y tenemos suficiente vacunas en nuestro estado para hacer las dos al mismo tiempo, para usar todas nuestras ideas para las personas no se han vacunado y también ofrecerlo para las personas de tercera edad el tercero.
Thank you.
Yes? Was there, what? Any other questions? I think, is there a technical issue there? Okay.
Schools get all this equipment, or how exactly is that rolled out?
Yeah. Well, not so much equipment. the tests are portable and the contractors handle it. So the masks can be delivered to any school that want them. And I think there's two sets of equipment you're talking about, masks and medical grade masks and testing equipment. So I'll get into the details on this so there's no confusion. At the school level, schools and districts can request medical grade masks. We then provide them. We provided 8 million to date total masks to schools. That will continue. Medical grade masks offer superior level of protection for those particularly worried about the virus, much more than cloth masks or regular masks. For testing, right now, we can make testing available for any school or district that wants it. They can request it, we provide it, it can be administered on site. After September 7th, that can be administered by contractors on site. Prior to September 7th, if the school needs help, we can still provide that on an ad hoc basis to make sure that it's done. So I hope, did that answer your question?
Yeah, it sounds like you have people there in the mornings for those who are choosing to do that, and
That's right.
that money coming from for incentives or
All federal, it's all federal funds. So this was in the, I have to find out whether it's CARES or Rescue Act. We'll get back to you. CARES or Rescue Act, one of the two, where the state, it's 100% federal funded. So no state funds are used, and we can implement this, including with the, providing with the contractors on site to do the testing. And again, we'll work on what that incentive component looks like, which is an important part of getting a level of participation that makes a meaningful contribution to keeping kids safe. Go ahead.
Just going back to the other question, I wasn't sure. So what happens when we don't see these numbers improve or if they go back to what we saw last year? Can you clarify just maybe what that means for the schools? What will they decide?
Well, again, there are two things that we are watching with regard to the schools. One is for people of all ages, we want to avoid overwhelming our hospitals. The most recent data we have is there's about 7 kids 11 and under in the hospital. We have more capacity. There's 500 adults in the hospital. Each one, it's a very sad thing when somebody's hospitalized. Many of them get better, especially kids, but some of them don't. We will act to avoid overwhelming our hospital capacity for people of any age if needed. The second thing is we want to make sure our schools can stay in person. And if school districts are wanting to avoid mask wearing as an excuse to go remote, we really won't abide that, because that will rise to the level of an emergency that we cannot afford to lose another year of in-person education for our kids. And the schools need to be back in a safe way.
Last question,
Following up on that question, so let's say a school does have a lot of cases and then they had to go remote.
Oh, yeah.
So you're saying at that point the state would come in and work?
Yeah, no. Quarantines are different than quarantine period for a class, or in the case of a whole site. I want to set expectations. That's to be expected this year, frankly. I think that there will be many times where if there are 2 or 3 kids in a class working with county health department, that class might have to go remote for 2 weeks. What we're talking about is what we're talking about is in-person education, except when there's an active quarantine that's being done. So the quarantines are a tool to actually be able to keep in-person education, because they're a selective, targeted focus of people who have to stay out for maybe 10 days and then go back in. That can be one of these layered protections to keep schools back in general. Again, they don't have to be the only one, and it's not effective if it's the only one, but that is one of the techniques to do it. So parents should be flexible this year. There might be periods of time where for 10 days or a week, your class might have to go online if there is an outbreak in the class, but that is done in the service of keeping schools in person and making sure that they can remain in person throughout the year. Thank you all.